Okay, to continue on with my discussion of SARS-CoV-2 COVID-19 questions, there's 50 on my question website under teaching points. We're only going to do about 10 of them. And the first session, we did the first 7 or 8. Now we're on to number 8 now. And it's titled Herd Immunity for SARS-CoV-2 Natural, Good or Bad. And this I will say that there are many complications of contracting the virus and having an actual infection. Almost everyone is left with some symptoms and signs of post-COVID infection. Some of these can become permanent. I did publish an article with the 100 most common post-COVID-19 symptoms and the ones that become chronic. And for example, the first most common one was like fatigue, and there are obviously many, many others. So the complications of having COVID-19 are many, and again, most patients who have a COVID-19 infection do have complications and long-term complications and signs and symptoms, and some have called it long haulers syndrome, which is the chronic complications of having COVID-19 after an infection. And so that is one reason that it is not good to catch COVID-19. There are secondary complications such as suppression of the immune system. And this is very significant, especially for one developing a complication of pneumonia, which obviously in some cases can be fatal or can be destructive to the lungs and lead to permanent pulmonary damage. Another reason is that many viruses are oncogenic, that is, they cause tumors and cancer. And many viruses do this, first by suppressing the immune system, the second by initiating genes that cause cancer, produce cancer, and in that way they are actually carcinogenic and oncogenic and immune suppressive. All of that adds together to produce a nasty predisposition for carcinoma and tumors. Many viruses, such as the Epstein-Barr virus, known to cause such things as possibly lymphoma, Burkitt's lymphoma, etc., leukemia, possibly, but others such as hepatitis B and C, causing hepatomas, cancer of the liver, that is. So, and many others cause different types of cancers. So, it is best and possible that this virus as well could be oncogenic, and so it is best not to contract the disease. So I would say that herd immunity from vaccination for SARS-CoV-2 is good. Herd immunity from natural infection is probably not so good. So I would avoid infection, and that's why so many precautions are being taken, and that's why the vaccine or vaccines are being administered as fast as humanly possible. So also a reason I would recommend that everyone get their vaccine to prevent the complications of COVID-19 infection, which again occur in almost everyone, at least as far as we know at the present time. The next number 10, is recurrent infections are possible. So not only is the virus mutating into different forms that can be reinfectious or cause a secondary and second infection, but it's noted the immunity wears off after at least several months, and that people can be even reinfected with the same virus, even one that has not mutated. So that's another thing to watch for, and another reason to get vaccinated. Hopefully the vaccine lasts longer, and if it doesn't, then boosters will be given or will have to be given. Again, there are, number 11, many multiple system complications of COVID-19 infections, and we've gone through some of these previously, but it does suppress the immune system, does cause or can cause fibrosis in the lungs, can cause brain infection and brain problems, disability, etc. So I will continue this on in my teaching points of COVID-19 number 3. Thank you.